The first topic I will talk about is hypertension. Why this topic is important? We have more than 120 million Americans who have hypertension. So when we reach the age of 60, 70% of us will have hypertension. In this room, a lot of patients and a lot of people have hypertension. The tricky part of it, almost half of us, we are not aware that we have hypertension. And only quarter of us, despite being aware, we have it under control. So it's a big challenge. What are the risk factors for hypertension? Anything we can do about it? Well, definitely the lifestyle we live is a big contributor to it. The diet, the processed food, the salty, sweety food, the fast food, the lifestyle we live, we don't do a lot of activity unless we intentionally trying to do that. The stress, which unfortunately there is no shortage of that for anyone. Also, some other medical problem could contribute to it, like sleep apnea, diabetes, and sometimes our genes. We could do everything right, but we still get hypertension because our mom, our dad, they had it, our grandparent at some point they had it, and they passed the gene to us. As I said, it's a big challenge for multiple reasons. A lot of people with hypertension, they are not aware of it. It's the silent killer. People don't feel it. They can go years and they be unaware of it. And when they be aware of it, a lot of them, they don't seek medical advice. Why? Because they don't feel it. It doesn't hurt them. They don't recognize how dangerous is it. If you have, if you see blood, you are bleeding, you get alarm. If you have pain in your chest, in your shoulder, you get alarm. But the blood pressure is tricky. You don't feel it. So a lot of people don't seek medical advice. And even the one who get it, try to treat it, we have big percentage of them. We have challenges why we cannot get it under control, and we go more into this. In a small number of patients, the vast majority, they don't feel it. But if you have symptoms related to the blood pressure, it's often extreme when the blood pressure is too high. Some people may have bad headache. They may have a blurry vision. They may have some shortness of breath, chest pain. In extreme situation, they may end with a bleed when the pressure is too high. But we don't want to reach that point. We want to identify it much more early. How can we know if we have high blood pressure or not? It's a simple way. You all have seen these devices all around. The classic way, the device you see in the left, we go manually, check your blood pressure, but you don't see much of these devices. Now, if you go to any pharmacy or grocery store, you will see some of these devices. The one the man is sitting, this is simple device. It inflate, deflate by itself, give you the reading within less than 1 minute. The other device, in some occasion, we use it for people who we want to monitor the pressure for 24 hours or something like that. If we are not sure if the reading we get in the office related to the white coat or other thing, sometimes we use this device. It's monitor the blood pressure for the whole day or couple days or something like that. But this is the simplest, easiest way to check your blood pressure. If you can buy one, there are plenty of them for like $20 or something, that's great. If not, maybe if you go to the pharmacy or a store, they have this big machine, just to stick your hand in it, make sure you are rested, see what is your blood pressure, just get an idea. Then what do you do with the number you get? We aim always to be in the green. We want the top number to be less than 120, the bottom number less than 80. Keep these two numbers in your mind. Top number 120, bottom 80. So if you are in that zone, you are good. This is the green where we are all happy about. If it starts creeping up, you get to be a little bit aware. If you start seeing above 120, but still above less than 130, the same thing, but still the bottom less than 80, you may not to be too alert, anxious about it, but you need to start monitoring your pressure at that stage. When you reach the point, the top number 130 or above, or the bottom number above 80, I think you should do something about it. Definitely, we don't want to be in the red, and the red is bad. If it's above 140, if the bottom number above 90 is not good. If you find you have bad symptoms, headache, blurry vision, chest pain, shortness of breath, you check your pressure, you found it above 180 or the bottom above 120, you should talk to a doctor. Whether you call your doctor, you go to urgent care, emergency room, don't sleep on it. Make sure you take care of that. Is the blood pressure all for everyone? Is hypertension one label we can give for everyone? Of course not. Is it the same for women and men? There are some differences, but not huge. So we see the women, they are later to develop hypertension, but they quickly catch up with men when they reach the 60. When they are 60 or older, almost it's equally distributed between men and women. Is all blood pressure the same? If you have a blood pressure of 130, is it the same if you have 180? Is not. The numbers is matter. For women especially, they are more sensitive for high blood pressure. And on the slide on the left, on this slide, you see how the blood pressure, when it start going up on number, how the cardiovascular problem take a spike here. So you want to stay in this area. What should you do? All of us do, regardless if you have hypertension or not. You need to monitor, you need to check your blood pressure, not every day if you don't have this problem, but every time and then you may check it, make sure you're still okay. Always is good to be proactive, change your lifestyle even before you have a problem. Watch your diet, avoid junk food, avoid salty food, processed food, canned food, so on and so forth. Healthy lifestyle, aerobic exercise, make it part of your routine. But also, if you start noticing, despite doing all the good things, you have issue with it, talk to a doctor, get some help. When we get consult for high blood pressure and somebody need help, what do we start with as a doctor? First of all, we want to make sure there is nothing causing people to have high blood pressure, because it's not isolated to problem. Sometimes it could be related to other things. Some people, they are not aware, they are snoring at night, they feel fatigued during the day, they have a sleep apnea, which is untreated and contributing to their high blood pressure. Some patients, they have kidney issue, which could be driving their blood pressure. So it could be signal of other things. That's what first things we want to make sure. You don't have other things that driving your blood pressure up. Then we will give you more consult and education about what you need to do, lifestyle modification, specific to you to bring it down or stay healthy or avoid the problem down the road. If we do that and sure no other things and you need to be treated, we always start with medication. And often it needs multiple visits to titrate the medication up, make sure we find you the right combination of medication that work for you the best. We know, as I referred early, despite good number of patients, they try to treat it, half of the one who try to treat it, they have difficulty getting that under control. And for multiple reasons, some of it could be it's hard to be adherent to medication. Some of it, just you have resistant hypertension. It takes a lot of treatment to get it under control. So somebody smart said, like, well, let's go back to the basic, see why people have high blood pressure and what other things we could do other than medication and lifestyle to lower the blood pressure. So as you see from this graph here, the blood pressure is very complicated, the process, and multiple organs are involved with this, including the brain, including the kidney, including the vascular, including the cellular, the insulin, the glucagon. It's very complicated, long topic. If we will talk, is not the main focus of this, but there are too many systems involved into controlling the blood pressure. One part of it is the kidney. They have a lot of nerves around the kidney, which give feedback and contributing to the hypertension. So the hypothesis, why don't we try to do something about the nerves, around the kidney, and see if that will get the blood pressure better? What the trial went through, they started the procedure through catheter, where they went with the small catheter through the artery in the leg up to the kidney, and with different devices. This device, it's balloon inflated in the renal artery and give pulses with ultrasound to ablate or burn this nerve around the artery. This other device, similar procedure but different design, but this work on radio frequency. It give energy to ablate this nerve and decrease the feedback from this nerve. There are a lot of trials, as you see through this slide. Simplicity, Spiral, Radiance, all these trials tested these devices to see if they are doing what supposedly they need to do. And if you look at the blue and the red, the blue, the blood pressure with the devices, the red was sham trial, where they did the placebo. Across the board, after this procedure, the devices, the blood pressure in average better between 5 to 15 points. Now, it doesn't cure hypertension. It helps lowering the blood pressure. Is that good enough? Despite it doesn't cure the blood pressure, but the data show if you lower your blood pressure by 10 points, you decrease your cardiovascular risk by 20%. If you decrease it by 10 points, you decrease all-cause mortality by 10%. So despite this procedure doesn't completely cure hypertension, it decreases the risk of cardiovascular event, it decreases, hopefully the hypothesis, it decreases the risk of mortality down the road. So it's another things you will have to control your blood pressure. Should all patients go for this procedure? No, we do it for selective people who struggle with hypertension. What type of people who may benefit of this procedure? The one who end in the hospital with hypertension emergency. If their blood pressure become 200 something, they have other complication of hypertension, they may be candidate for that. If they have resistant hypertension, they take all the medication the doctor recommended for them. Despite that, their blood pressure is not coming down and there are no other causes, we could treat to get it under control. And often when we say it's not under control, we're referring to this number, 140/90. Are all the patients candidate if they have this? Small number of patients may not be candidate if they have advanced kidney disease, or if they have certain anatomy, their arteries are too small, they may not be candidate. So this is my first topic, and probably good number of you could relate to the prevalence of this. If you don't have it, you may have seen your neighbor, your relative, your parents, at some point they may struggle with this problem.